especially healthcare. And then a bill was passed this summer to make the situation far worse. The president used to call it the one big beautiful bill, but now it is so deeply unpopular, he never even brings it up. The reason, of course, why it's so deeply unpopular is, according to CBO, as well as other independent estimates, this bill will cause approximately 15 million Americans to lose their health care, and premiums for tens of millions more will rise. The beginning of those cuts to take effect is January 1, specifically on the Obamacare or ACA exchanges. The average, and this is just the average expected increase in our home Commonwealth of Pennsylvania, is 102% on our state's exchange. I've seen other states where it's even higher.
Listen to me, because we're about to rip apart a performance that exposes everything rotten at the core of this administration and this Republican agenda, and what you just witnessed is Pennsylvania Congressman Brendan Boyle doing what every single Democrat in Congress should be doing right now, standing before the American people and saying with absolute clarity that Trump has stopped calling it the big beautiful bill, because Republican plans to slash Medicaid and dismantle the Affordable Care Act would rip health coverage away from 15 million Americans and raise costs for millions more families. And when your signature legislative achievement becomes so catastrophically unpopular that you can't even speak its name anymore, that tells you everything you need to know about the moral bankruptcy of this entire project. The congressman is speaking in a hearing about the Congressional Budget Office projections, and he's laying out numbers that should make every single American's blood boil, because in Pennsylvania the average increase is 102% on the state's ACA exchange, which means families paying $500 a month will suddenly be paying $1,000 a month starting January 1st, and this isn't some abstract policy debate or some wonky discussion about marginal tax rates. This is about whether your grandmother can afford her insulin, whether your sister with a chronic condition can see her doctor, whether working families in this country can survive the most vicious assault on healthcare access in American history. Now here's where this gets even more devastating, because you need to understand what's actually happening in the architecture of cruelty that Republicans have constructed, and the numbers are so staggering that they almost lose their meaning until you remember that behind every statistic is a human being, a child with asthma, a cancer patient undergoing treatment, a disabled adult who depends on Medicaid for survival. Altogether, 16 million people could become uninsured over a decade, the same number who were at risk of losing their insurance when Republicans attempted to repeal the Affordable Care Act in 2017. According to the CBO. Think about that for a moment, because the Republican Party learned absolutely nothing from their spectacular failure in 2017 when massive public outcry stopped them from destroying the ACA, when protesters in wheelchairs were dragged from Senate offices, when town halls erupted in fury across this country. And what did they do? They waited. They rebranded their assault with Trump's carnival barker language about something big and beautiful, and then they rammed through the largest cut to healthcare in American history while pretending it was about tax reform and economic growth. But let's drill down into what Congressman Boyle is really exposing here, because the Pennsylvania numbers are not an anomaly. They're a preview of what's coming for the entire nation, and Armstrong County plans will jump 103%, while Allegheny County will see average plans increase by 75%, and these are real Pennsylvania counties where real Americans live and work, and raise their children, and the Republican response to this devastation is to simply stop talking about it, to memory hole their own legislation, to act as if the One Big Beautiful Bill Act never existed, even though the legislation is known as the One Big Beautiful Bill Act, and it passed the House and it's now being considered in the Senate, where it will determine whether millions of Americans have access to health care or whether they're thrown to the wolves of medical bankruptcy and preventable death. The cowardice is breathtaking, because Trump loved this bill when he thought it would be popular. He branded it with his characteristic grandiosity, and the moment the polling showed Americans saw through the con, he vanished like a ghost, refusing to defend the policy that will define his presidency's assault on the social safety net. And here's what makes this even more enraging, what elevates this from mere policy disagreement to an act of class warfare so brazen it would make the robber barons blush, because the tax cuts for millionaires in the law averaging $80,000 per household will cost the same as the healthcare cuts that will take health insurance away from 4.7 million people by 2034. Read that again and let it sink into your consciousness, because this is the trade, this is the exchange, this is the devil's bargain that Republicans are offering to the American people, and they're taking your healthcare, your mother's Medicaid coverage, your child's CHIP enrollment, and they're liquidating it, converting it into cash, and handing it directly to people who already have more money than they could spend in 10 lifetimes. This legislation provides a huge permanent tax cut of nearly $350,000 for multimillionaires and billionaires, while people earning $40,000 a year will see a comparatively meager average tax decrease of $442 per year. And that disparity, that obscene mismatch between what the wealthy receive and what working people lose, that's not a bug in the Republican economic philosophy. That's the entire operating system, that's the point. That's what they've been building toward for 50 years since the Powell Memo and the dawn of neoliberal economics and the systematic dismantling of the New Deal consensus. But wait, because it gets worse, and you need to hear this. You need to understand the full scope of the devastation because the CBO found that the House-passed bill, when coupled with proposed Trump administration changes to the Affordable Care Act, would lead to 16 million people losing coverage by 2034, and that's not even accounting for the enhanced premium tax credits that are expiring. The subsidies that have helped millions of Americans afford their health insurance since 2021, expiration of the enhanced premium tax credits is estimated to more than double what subsidized enrollees currently pay annually for premiums, a 114% increase from an average of $888 in 2025 to $1,904 in 2026. Just sit with that reality for a moment, because if you're one of the more than 24 million people enrolled in the marketplace with the vast majority receiving an enhanced premium tax credit, you're about to see your costs more than double, not because your health got worse, not because you're consuming more health care, but because Republicans in Congress and their enablers in the Trump administration have decided that maintaining subsidies that help working people afford health care is less important than showering the wealthy with tax breaks they never asked for and don't need. Now let's talk about Medicaid, because this is where the Republican plan reveals itself as not just cruel but genocidal in its implications, and I don't use that word lightly because this would be the biggest cut to Medicaid. In fact, the biggest cut to healthcare in history, according to healthcare policy experts, and the law will cut Medicaid by more than $900 billion, the largest cut in the program's history, and CBO estimates that 7.5 million people will lose Medicaid as a result of these cuts and become uninsured in 2034. These are not people who can simply go out and buy insurance on the private market, because Medicaid exists precisely for those who cannot afford private insurance, for children in poverty, for pregnant women without resources, for elderly Americans in nursing homes, for people with disabilities who require constant care, and it's low-income kids, adults who are working but don't have health insurance through their jobs, people with disabilities and seniors who need help paying their Medicare premiums, or who are in nursing homes because Medicare does not cover nursing home or long-term care, so it's really Medicaid that ends up picking up the slack there. Think about what this means in concrete human terms, because your grandmother in a nursing home right now, the woman who raised your parent, who worked her whole life, who contributed to this society, she's being cared for today because Medicaid pays for that nursing home bed, and when Republicans slash $900 billion from Medicaid, that nursing home is going to have to make choices, brutal inhuman choices about whether they can continue to provide that care, whether they need to reduce staff, whether they need to cut services, whether they need to discharge patients who have nowhere else to go. The policy papers don't talk about this. The Heritage Foundation white papers don't mention the elderly woman confused and frightened being told she needs to leave the only home she's known for years because the funding has been cut. But that's the reality. That's what happens when you treat healthcare as a budget line item rather than a human right. When you decide that the social contract that binds us together as a civilization is less important than delivering tax cuts to billionaire donors. And here's the really sinister part that you need to understand about how Republicans are structuring these Medicaid cuts, because they're not just reducing spending, they're fundamentally restructuring the program in ways designed to kick people off coverage through bureaucratic cruelty, and CBO estimates that 5.3 million people will lose Medicaid and become uninsured in 2034, as a result of the provision that will take coverage away from people who don't meet a harsh work requirement. Now let's be absolutely clear about what work requirements actually mean, because Republicans frame them as promoting self-sufficiency and personal responsibility. In reality, these are work reporting requirements that institute paperwork requirements that end up keeping people who meet the requirements off of Medicaid, and every attempt at implementing work reporting requirements to date has led to catastrophic results, massive coverage losses, including among people who are working because of needless red tape, without actually encouraging work. Arkansas tried this. They implemented Medicaid work requirements, and thousands of people lost coverage not because they weren't working, but because they didn't navigate the bureaucratic maze correctly, because they didn't have reliable internet access to report their hours online, because they were working multiple part-time jobs and couldn't figure out the documentation requirements, because the entire system was designed not to verify employment, but to create barriers to coverage. The cruelty is the point. And I want you to understand this because when Republicans talk about work requirements, they're not actually interested in whether people work, because 2/3 of people aged 19 to 64 receiving Medicaid in 2023 worked during the year, and many of those who didn't work were taking care of a family member or had an illness or disability, so the people on Medicaid are already working. They're the home health aides making minimum wage. They're the retail workers whose employers don't provide health insurance. They're the gig economy drivers who string together multiple jobs to survive. And what Republicans are doing is creating an administrative gauntlet designed to make it so difficult to maintain coverage that people fall through the cracks. And the only way to achieve savings through this method is for people currently using Medicaid to lose coverage. That's the admission right there. The quiet part said out loud. Because if work requirements actually helped people transition to employer-sponsored coverage or higher-paying jobs, there wouldn't be any budget savings. The savings only materialize when people lose coverage and become uninsured, and show up in emergency rooms with preventable conditions that cost the system far more in the long run, but don't show up in the 10-year budget window that Republicans care about. Now let's talk about Pennsylvania specifically, because Congressman Boyle represents a state that is about to be absolutely devastated by these changes, and the numbers he's citing aren't projections, they're not estimates, they're the approved rate increases that Pennsylvania families will face, and small business owners, gig workers and other Pennsylvanians who buy health insurance through the Affordable Care Act marketplace will see premiums rise on average by nearly 22% for coverage next year, according to state officials, but individual and small group rates will vary depending on the insurance company, specific plan, where someone lives and their income, but state insurance regulators say some of the market's current 496,000 customers will still see prices that are shocking. Shocking, that's the word that state insurance regulators, not partisan Democrats but state bureaucrats tasked with overseeing insurance markets, are using to describe what's coming, and Pennsylvanians all across the state are experiencing sticker shock as their healthcare premiums nearly double. Nearly 500,000 people in Pennsylvania who buy plans on Pennie will need to shop for coverage that will cost them on average double what they paid last year. Double. Your healthcare costs are doubling, and this is not because of market forces. This is not because of inflation. This is because the spike in costs is being driven in part by the fact that Congress hasn't extended enhanced tax credits that currently help people afford their monthly premiums, and those enhanced credits were passed in 2021 as part of COVID-19 relief funding and are set to expire at the end of the year, and Democrats in Congress are sticking together by refusing to vote for the clean continuing resolution Republicans want because it fails to extend these subsidies. This is the fight right now. This is happening as we speak, and Republicans are willing to shut down the federal government rather than extend subsidies that help working people afford health care, and Trump, who promised to lower costs on day one, who ran campaign ads showing him as a champion of affordable health care, is spearheading the longest shutdown in U.S. history to terminate ACA tax credits as 500,000 Pennsylvanians log on to the ACA marketplace to find that their health plans are more than twice as expensive as last year. The betrayal is so complete, so total, so comprehensive, that it almost defies description because every promise was a lie, every campaign commitment was theater, every town hall pledge was a performance, and now the masks are off and we can see the actual agenda, which is to transfer wealth upward, to extract resources from the poor and middle class, and deliver them to the oligarchs, to dismantle the social safety net that generations of Americans built through collective struggle, and replace it with a Darwinian nightmare where your access to healthcare depends on your bank account and your ability to navigate bureaucratic obstacles designed to exclude you. This is not conservatism in any meaningful philosophical sense. This is not about limited government or fiscal responsibility. This is plutocracy. This is oligarchy. This is the creation of a permanent underclass denied access to basic necessities, while a tiny elite accumulates obscene wealth, and the Republican Party has become the instrument through which this transformation is being executed. And here's what you need to understand about the broader economic context, because Congressman Boyle mentions this and it's crucial, because it's not just healthcare that has become unaffordable in America. It is beef, it's other groceries, it's coffee, it's electricity, and almost every staple in the average consumer basket has increased in cost under Trump's economic policies, and yet Republicans are taking a situation where Americans are already struggling with affordability and making it catastrophically worse by doubling healthcare premiums, by taking away Medicaid coverage, by slashing SNAP benefits, and while they're doing all of this, they're handing out tax cuts to people who are already wealthy beyond measure. This budget rips healthcare away from millions while handing out $4.5 trillion in tax breaks, the overwhelming majority of which go to billionaires and wealthy corporations, and it slashes at least $230 billion from food assistance programs, at a time when grocery prices remain at record highs, and it proposes at least $880 billion in cuts to Medicaid and the Affordable Care Act. Let that sink in, because while your grocery bills are higher than ever, while you're struggling to afford eggs and milk and bread, Republicans are cutting food assistance, and while your healthcare premiums are doubling, they're cutting Medicaid and the ACA, and while you're watching your family budget get squeezed from every direction, they're giving tax cuts to billionaire donors at Mar-a-Lago, because as Trump said to them, "You're rich as hell, we're going to give you tax cuts." That's the quote. That's what Trump actually said to a room full of billionaires at his private club, and at least he was being honest in that moment. At least he was telling his real constituency what the plan was. And now we're seeing that plan executed in real time with devastating consequences for tens of millions of Americans. But here's where this gets even more infuriating, because Republicans spent years, decades even, positioning themselves as the party of fiscal responsibility, the party that cares about deficits, the party that worries about leaving debt to our grandchildren. Congressman Boyle points out how many times over his adult life, whenever there's a Democrat in the White House, Republicans bemoan the size of the national debt. But now we have a Republican trifecta controlling the House, the Senate, and the White House. And where's their debt reduction plan? It's not here. In fact, they increased the national debt by $4 trillion. And when it comes to adding to our national debt, no president in American history added more than Donald Trump. The hypocrisy is so staggering, so complete, so undeniable, that it reveals the entire fiscal responsibility rhetoric was always just cover for their real agenda, which is cutting programs that help the poor and middle class, while expanding tax cuts for the wealthy, and the deficit only matters when Democrats want to invest in infrastructure or education or healthcare. But when Republicans want to shovel money at billionaires, suddenly the deficit disappears as a concern for me. Suddenly we can't afford to run up the national debt, becomes we must run up the national debt to give tax cuts to people who already have more money than God. And let's talk about who specifically is going to be hurt by these cuts, because it's not abstract, it's not theoretical. These are your neighbors, your family members, your community. The loss of health subsidies combined with premium increases for 2026 will disproportionately affect people in rural areas, older residents who aren't yet eligible for Medicare, and working middle-class earners, according to estimates from Pennsylvania's Exchange. Rural areas, the places that voted overwhelmingly for Trump, the communities that believed his promises about bringing back prosperity and lowering costs, those are the places that are going to be hit hardest by these healthcare cuts. And there's a particular cruelty in the fact that the people who trusted Trump most are the ones who are going to suffer most from his betrayal. The elderly couple in rural Pennsylvania who aren't quite 65 yet, who lost their employer-sponsored insurance when the local plant closed, who have been scraping by on ACA coverage with enhanced subsidies, they're about to see their premiums double, and they have nowhere to turn, no alternatives, no safety net, and when they end up in the emergency room with a preventable condition because they couldn't afford their medications, that's when the cost of this policy will become real. But by then it will be too late. Now I want to focus on something particularly sinister that's embedded in this Republican plan, because it's not just about cutting Medicaid, it's about how they're cutting it. The bill would cut the federal matching rate for the Affordable Care Act's Medicaid expansion in the 14 states plus the District of Columbia that created and fund solely with their own state funds comprehensive health coverage programs to cover people without a documented immigration status. So Republicans are punishing states that chose to expand healthcare coverage. They're penalizing state sovereignty. They're saying if you dare to use your own state money to provide healthcare to immigrants, then we're going to slash your federal Medicaid funding. And this is about inflicting maximum pain on blue states, on states that refuse to go along with the Republican healthcare agenda, on states that actually care about their residents having access to medical care. The policy is designed to force states to make impossible choices, to either abandon healthcare coverage for vulnerable populations or lose federal funding that they depend on for their entire Medicaid program, and it's extortion, it's blackmail, it's the federal government using its power to punish states for making different moral and policy choices. And let's be clear about the immigration component, because Republicans love to demagogue this issue. They love to claim that undocumented immigrants are draining public resources, But the reality is undocumented immigrants are not eligible for any federally funded program, whether that's Medicaid, Medicare, or the Affordable Care Act, and some states have used their own money to provide health care to undocumented immigrants, and there was a proposal in this bill to cut off federal funding to reduce the amount of federal funding for Medicaid to those states to effectively penalize them for using their own funds to cover undocumented immigrants. Your own funds. States are using their own tax revenue, money they collected from their own residents, to provide health care to people living in their communities, and Republicans want to punish them for that choice by cutting unrelated federal Medicaid funding, and the cruelty is the point. The punishment is the objective, because this isn't about fiscal policy, this is about using healthcare as a weapon to enforce Republican ideology and Republican priorities on states that democratically chose different values. But here's what should terrify every single American, regardless of your political affiliation, regardless of whether you voted for Trump or voted against him, because the sprawling reconciliation package would trigger over $500 billion in automatic cuts to Medicare, according to a Congressional Budget Office estimate, because of the size of the deficits, because of the Pay-As-You-Go or Pay-As-You-Go Act that would trigger sequestration of Medicare, and it would total over $500 billion with the official figure that CBO confirms being $535 billion in cuts to Medicare. Medicare, the program that Republicans swore they would never touch, the program that Trump promised to protect, the program that every single American who paid into the system their entire working life expects to be there when they turn 65, that program is about to be slashed by over $500 billion, and Boyle and other Democrats said the looming Medicare cuts amount to a betrayal of President Donald Trump's vow to shield the program, a promise that was included in the GOP's 2024 election platform. The betrayal is total, the lies are complete, and this is what Republicans do. Pay for massive tax breaks for billionaires by going after programs families rely on the most, Medicaid, food assistance, and now Medicare, and it's reckless, dishonest, and deeply harmful to the middle class. Every promise Trump made was a con, every commitment was theater, every pledge was calculated deception designed to get elected so he could execute this agenda of upward wealth transfer, and now we're watching it happen in real time, and the question is, what are we going to do about it? How are we going to respond? How are we going to organize resistance to what is genuinely the most significant assault on the social safety net since the New Deal, since the creation of Medicare and Medicaid in the 1960s, since the passage of the Affordable Care Act in 2010? Because here's what makes this moment so dangerous, what makes the stakes so impossibly high. This bill would make historic cuts to Medicaid and the Supplemental Nutrition Assistance Program, while terminating clean energy tax credits that have both lowered energy costs for the American people and created hundreds of thousands of good-paying American jobs. This would be done solely to give the wealthiest Americans a new massive tax break. Solely, that's the only reason, that's the entire justification. And when you step back and look at what's being destroyed and what's being built, you see clearly that Republicans are dismantling the infrastructure of a functioning society, the programs that keep people healthy and fed and housed, and they're converting that into private wealth for oligarchs. And this is not sustainable, this is not compatible with democracy, because when you create a society where tens of millions of people can't afford health care, where children go hungry, where the elderly are thrown out of nursing homes, where working people can't afford the basics of survival, you don't have a democracy anymore, you have an aristocracy, you have feudalism with better technology. And I want to talk about the politics of this because Congressman Boyle is doing something crucial here, something that every Democrat needs to learn from, because he's not being mealy-mouthed, he's not hedging, he's not trying to find common ground with people who are executing a plan to take healthcare away from 16 million Americans. He's calling it what it is. He's saying 15 million Americans are going to lose their healthcare because Republicans care more about tax breaks for billionaires, and it's accurate. And the reason this is so important is that Democrats have spent too long trying to win arguments through technocratic competence, through policy white papers, through appeals to procedural norms, when what this moment demands is moral clarity, is righteous anger, is the willingness to say that what Republicans are doing is not a legitimate policy difference, but an act of violence against the American people. Because when you take away someone's health care, when you make it impossible for them to afford their medications, when you force them to choose between seeing a doctor and paying rent, you are shortening their life, you are causing suffering, you are inflicting harm, and we need to talk about this in those terms. We need to make clear that these are not bloodless budget cuts, but decisions that will lead to preventable deaths, to avoidable suffering, to children with untreated illnesses and elderly people dying alone because they couldn't afford care. The policy is violence, the legislation is harm, and Democrats need to say that clearly and repeatedly, and without apology, because the stakes are too high for euphemism, the consequences too severe for diplomatic language. And here's what you can do right now, today, this moment, because the loss of these tax credits is at the center of the ongoing federal government shutdown, and Democrats in Congress are sticking together by refusing to vote for the clean continuing resolution Republicans want, because it fails to extend these subsidies. So this is the fight, this is the battleground, and Democrats are actually holding the line for once, actually using their power to demand that healthcare subsidies be extended, and they need to hear from you. They need to know that their constituents support this fight, that we want them to hold firm, that we will not accept a deal that sells out millions of Americans to corporate interests and billionaire tax cuts. Call your senators, call your representatives, show up at town halls, organize in your communities, make it politically impossible for Republicans to execute this agenda, because the only way we stop this is through sustained public pressure, through mass mobilization, through making clear that there will be electoral consequences for anyone who votes to take healthcare away from millions of Americans. This is not about partisan advantage. This is about the kind of society we want to live in, about whether we believe healthcare is a human right or a commodity, about whether we think government exists to protect the vulnerable or to enrich the powerful. And Congressman Boyle's performance in that hearing was a model of what moral leadership looks like in this moment, standing up and saying clearly what is happening, who is responsible, and why it matters, refusing to let Trump memory hole his own signature legislation, refusing to let Republicans pretend they're not executing the largest cut to healthcare in American history, insisting on clarity and accountability and truth even when those in power would prefer we look away. Trump's so-called plan to fix healthcare was revealed when he signed the Big Ugly Law, the largest cut to healthcare in American history, and his real plan strips coverage from 15 million Americans and forces millions more to pay even higher premiums, and we cannot let this stand. We cannot accept this as normal. We cannot allow the brutality of this agenda to be normalized through repetition and media coverage that treats it as just another policy debate rather than a fundamental assault on human dignity and survival. The fire is here. The crisis is now. And what we do in the next few months will determine whether we preserve any semblance of a social safety net, or whether we complete the transition to a society where your health, your survival, your ability to see a doctor when you're sick depends entirely on your wealth and your proximity to power. And I'm telling you that we cannot let that happen, that we must fight with everything we have, that the resistance to this agenda needs to be total and sustained, and uncompromising, because 16 million people losing healthcare is not an acceptable policy outcome. Doubling premiums for working families is not an acceptable political compromise. Slashing Medicare and Medicaid to pay for tax cuts for billionaires is not something we can accommodate or normalize or accept as just how politics works. This is the fight of our time. This is the test of whether we have the courage and conviction to defend the most vulnerable among us, and Congressman Boyle just showed us what that looks like. Now we need millions more to join him.